Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. This week's episode is centered around the recently concluded CMSC annual meeting. First up, for patients with multiple sclerosis who have higher baseline levels of disability and those who are older, treatment with ocrelizumab does not appear to be associated with a higher rate of adverse events according to real-world results from Acapella, a single-center prospective study. Presented in a poster at the 2021 annual meeting of the Consortium of Multiple Sclerosis Centers, or CMSC, the data show that those with an expanded disability status scale score of 6 or higher had a slightly higher rate of urinary tract infections, but no increased incidence of infections or herpes simplex virus 1 or 2 compared with the overall population of 354 patients. Similar results were observed for the group aged 55 years and older for rates of both HSV1 and 2 and overall moderate infections. Next up, switching to ocrelizumab from other disease-modifying treatments for multiple sclerosis is associated with improvements in work productivity and a decrease in overall symptom burden, according to an analysis from the Phase 3b CASTING trial. In this analysis, 680 patients with MS with a suboptimal response to 1 or 2 prior DMTs received 600 milligrams intravenous ocrelizumab every 24 weeks for 96 weeks, which during changes in the work productivity and activity impairment or WPAI questionnaire, 29-item multiple sclerosis impact scale, and symptom MS screen were assessed at baseline, week 24, year 1, and year 2. From baseline to year 3, significant reductions in overall work impairment and activity impairment were recorded as improvements in WPAI, with consistent trends noted in the work time missed and impairment while working. Lastly, although most patients with multiple sclerosis had discussed cannabis with their MS physician, only 12% of patients considered them their primary source for medical guidance on the matter, suggesting that inadequate medical and clinical information sources are available to these patients and their healthcare providers. There are currently no THC-containing FDA-approved medications for physicians to prescribe patients with MS. In total, 48% of every users reported that either nobody or themselves was the primary person for providing medical guidance for cannabis use. Dispensary professionals, used by 21% of the entire cohort, were the second most, ahead of MS physicians, other patients with MS, other licensed healthcare providers, and pharmacists. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.